In honor of Veterans Day, it's important to focus on the health challenges many of our veterans experience. From managing physical injuries to the mental toll of service, our veterans deserve our support. Today, we are joined by Dr. Jolene Cannady with Health Crissman Family Practice, here to talk about common health conditions and health risk veterans face and what we as a community can do to help. So we're going to start right here. What are some of the most common health conditions veterans are at higher risk for?
So this depends on the period of time that they served, and we have different periods. So right now in the World War II and Korean War veterans, we see them aging, and we still do have some World War II veterans out there. And with aging, we're starting to see dementia, which can be difficult for families because they may share stories that they've never shared before with families. And so families may hear things that they necessarily might not have heard before. If we enter into our Vietnam veterans, they're the ones who had the risk for Agent Orange exposure. So then in that population, we see diabetes, hypertension, and multiple different cancers that are related to that specific exposure. And then from the generation starting from Vietnam War to present, we see more of the traumatic brain injuries, which we've studied more over the years. And then also various chemical and environmental exposures that place them at higher risk for cancer. In fact, they are twice as likely to develop ALS, and we also see neuropathy, fibromyalgia, and chronic fatigue syndrome more in that population.
Sure, and going on more with the toxins during service, what should veterans watch out for and how important are regular health screenings?
So I am a big proponent for preventative medicine. So for my veterans, I feel like they should go for annual exams and definitely ensure they are up to date on all necessary screenings, especially cancer screenings. And then they should watch for some of those signs that may show that they are having issues in regards to cancer or other health issues. So things like unexpected weight loss, night sweats, persistent fevers, difficulty breathing, irregular heartbeats, muscle weakness or spasms, and then just a natural increase in fatigue. So these are things they should watch out for, but as well go for their preventative screenings.
Are there unique challenges older veterans may be experiencing that we should be aware of?
So for the older veterans, especially when we're looking at our Korean War, World War II veterans, like I said earlier, we're seeing more dementia, and this is something I've seen in my practice. So these are populations that might not necessarily have shared their stories with their families. They were a little more quiet about that. And so I do find that when dementia starts, they do start to share those stories more as they go back in time. So they may have more flashbacks to wartime. They may be very scared of loud noises, and this can be very challenging for caregivers. So I definitely recommend caregivers reach out for assistance whenever needed.
And post-traumatic stress disorder can impact veterans. What are signs that may indicate someone may be struggling with PTSD that families and friends should, of course, watch out for?
So some of the big things I tell families and friends to watch out for are things like flashbacks. So this could be while they're awake. Something like a loud noise could set that off, or they might be having nightmares while they're sleeping, and that can wake family members up. If while they're awake, it can be a trigger event. Like I had one patient one time tell me it was fireworks that caused him to have a very big panic attack, and he had to leave that event just because the fireworks kind of brought on a flashback for him. And then they can have an increase in negative thoughts. So they may not be as interested in doing things they once enjoyed. And they can start blaming themselves or others for just events that have happened. And then they can start avoiding people and events. And then the last thing is that they can get very hyper aroused. So where the brain is constantly on and they don't relax. So they have difficulty sleeping. When they're out, they may be fearful of the surroundings, and they may become more irritable, especially if something happens to trigger those memories.
And transitioning back into civilian life can be tough. Talk about that and how family members and friends can help veterans through this process.
So the one thing I hear from veterans a lot is that they would like family members and friends to let them do it on their terms and not necessarily ask them what happened overseas, to let them share their stories on their own terms. And so in the military, they're trained to be very hypervigilant. So when they return home to a place where they don't have to assess anymore and constantly look for threats, that can be very challenging for them. And then there also may be some grief over losing some of their fellow members and Also grief over losing that very structured environment where they knew their role. So now they come back into civilian society and they have to learn a new role, which can be very difficult. And then the big thing I tell family members is just to support them and encourage them to take step forwards and understand that if they don't express emotions for a while, that's okay. Because in the military, they're trained to kind of repress those emotions, just because if they could get in danger in certain situations if those emotions are let out.
How can veterans stay proactive about their health during and after their service?
So the first thing that I recommend they do is to find a primary care provider, whether that be in the VA or the civilian sector. And that way they can ensure that they are staying on top of all their necessary screenings and getting their vaccines and making sure that they're keeping an eye on their mental health. So staying active, and if they notice anything concerning, ensure that they reach out to someone for help. And the other thing I always recommend is that veterans let a civilian provider, if they have a primary care provider in the civilian sector, know that they have served, because that helps us know what we need to look for in case of exposures.
And how can family members support veterans who may be reluctant to seek help, especially for mental health issues?
Okay, so one thing I hear a lot from veterans is that they want to be given some space and they want to be given some time to talk about their situation, because it can be very difficult for them coming back into the civilian sector. And still, mental health still has a major stigma around it, especially for those in the military. Because when we think of military, we think of strong heroes. And so they are looked at as tough and strong, and they fear that if they go into talking to their family about mental health, that they're going to be judged. So I feel like as a support system, let them know that you can go with them to any appointments and be a partner beside them, and then help them feel comfortable with mental health and with seeking help, and create a safe space for them.
And what are 2 misconceptions about veterans' health that you'd like to set straight?
So the first one is all veterans have PTSD. That is a major myth. Not all veterans have PTSD, and it really depends on genetic makeup and how the brain works for each veteran. So that's a big one. Some veterans, they transition very well back to civilian life and they do not have any post-traumatic stress syndrome. And then some do come back and struggle with mental health disorders. And then the second one is that only combat veterans face health challenges. And that's not very true as well, because there are many veterans who never saw combat, who were just in training, and they could have had a traumatic brain injury while they were in training. They could have chronic pain, so from jumping out of planes, or different injuries while they're training. And because training can be very vigorous, and it takes both physical and mental health to work through this. And then while training, they can get a lot of different injuries. And then there's also different sort of incidents within training that can cause some PTSD.
Yeah, how important is early intervention with both the physical and mental health challenges veterans face?
So early intervention, I feel like, is the main key. The more knowledge we have of this population, the better we can care for them in the civilian sector. If we create an environment where veterans feel heard, then we can encourage early intervention and help them before a problem becomes too big.
Okay, and what should the community know about creating a supportive and healthy environment for veterans in their everyday lives?
The first thing I would say is just to give them space. On return to civilian life, they may not want to interact much because they're coming from that brotherhood or that sisterhood, just that family, and they're coming back into an environment where they have to learn a different role. So they may be constantly on, and they may be a little more hypervigilant than before. It doesn't mean that we can't help them transition. It just means that we have to let them do that on their own terms. And then always ask them what you can do for them, and let them know you're there for them on their terms.
Yeah, absolutely. Any final thoughts on what we should know about veterans' health?
I think the big thing that I hear from veterans a lot is just monitor what you are asking them. Don't ask them if they hurt anyone, or if they saw people pass away, or what wartime was like, because some of them are not ready to discuss that, and that can be very challenging for them, especially if they're struggling with mental health issues and they're struggling with maybe doing things that they necessarily didn't want to do. And then we need to allow veterans to discuss things on their terms, and sometimes we may never hear their stories, and we have to be okay with that, and we have to let them process their stories on their own time.
Absolutely. Well, thank you so much for being here. And we know that mental health is such an important conversation. So happy we were able to have this discussion.
Thank you. I appreciate it.
Absolutely. Well, remember, if you missed our entire conversation, you can find it on WFMYnews2.com. Tim.